Good morning. It's Thursday, May 15th, and I want to talk to you about one of the problems that continues to raise its ugly head in this country, and it has to do with healthcare. And it has to do with the healthcare that we want to provide to our population. So Medicaid has certain work requirements. And those work requirements can kick hardworking people off health care coverage. So that is something that really needs to be looked at, and looked at very carefully. Because in Washington, lawmakers are looking to slash federal spending. And Medicaid cuts could be on the table. And they probably will be on the table. So we have to watch out for that. And proposals to implement work requirements for coverage eligibility should be off the table. One of these senators has talked strongly about. That would be Democratic Senator Raphael Warnock. He is against a work coverage eligibility assigned to getting health care. He says that's a good way to knock people off their health care. And why do we want to attack hardworking Americans who are struggling? So there are many, many intricacies involved with getting our nation the proper health care. And the Republicans are surely looking for substantial cuts in Medicaid in order to reconcile the current budget legislation. But one way of restricting access to coverage, which is work requirements, could have disastrous results for Americans. And this is based upon efforts that occurred in Arkansas and Georgia, who implemented those work requirement policies. And they failed drastically because those rules required people to meet certain work thresholds. A certain numbers of hours of work per month to qualify for the Medicaid coverage. But it doesn't work for everybody. Certain number of hours doesn't work. So when we talk about labeling work requirements, they should be maybe considered as work reporting requirements. Because there's so many rules that they attach to those requirements and forms and other red tape that they prevent working Americans from accessing coverage. So getting health care for people in this country is a disaster that needs to be looked at very carefully. And you can't have work requirements that don't incentivize work. And if you have work requirements, if people looking at that recognize that that might be a problem for collecting their health care. So they may not get health care or they may not work. This is a disaster for many hardworking Americans. And a disaster for many Americans who need health care. So when the Republicans were putting together legislation for amounts of spending money, they wanted $880 billion in spending cut from now till 2034. And one of the ways they found to cut that spending is to cut Medicaid in some way, shape, or form. So one of the requirements would be working in order to collect Medicaid or Medicare or whatever it is they call it. And I'm not against a requirement like that, but these things are very difficult to lay out clearly, and they're very difficult on the people who have to follow those rules, because health issues can overcome a lot of work rules. So maybe I'm not healthy enough to give you 40 hours a month of work or something along those lines. So when we mix healthcare with work requirements, we are in a dicey situation. And these proposals affect millions of people. Somewhere between 10 and 15 million people are affected by some of the rules that they would impose upon Medicaid in order to get coverage. So what are we going to do? How can we solve this problem? I am sure that those who are in charge of attempting to solve the problem may not have the critical expertise needed to solve such a problem. Because I think no matter which way you turn, how many hours to work, how much should Medicaid cost, how much of this and how much of that, nobody has a really good answer. And Medicare is critical in this country. We have too many people who don't have coverage, and we need to get those people covered. So I can't give you an answer on what we need to do in the area of the law of healthcare requirements. But we ought to be able to figure something out. And it's not a national problem. It's dumped in the hands of the states. So there's no national healthcare rules that anybody has to abide by. All of these rules are in the hands of the state. And from what we saw in Georgia, they failed. So this is a dicey situation that must be corrected in some way, shape, or form. Healthcare, critical for this nation to continue to be rock solid. So I offer you that, and have a great day if you can. Take care. Bye. Bye.